Disc replacement surgery has been around for over 20 years now in spine. And it gained popularity because we were trying to restore the natural motion to the spine. And so, classically, if you have a spine that is degenerative and it is causing stenosis or tightness around a nerve, we would go in there and put it in a good spot and then fuse it in that spot. The idea behind disc replacement or arthroplasty in the spine is that we can take the pressure off the nerve, put the spine in a good position, and then put a device into that space between the vertebral bodies, which is where the disc normally lies, and restore the motion or maintain the motion back to the spine. And initially we thought it was going to do that, and most of the current literature says that whether you have a disc arthroplasty or a fusion of the neck, the outcomes for the patients are very similar. So at 10 years or 15 years, patients both are on track to kind of do the same. And we thought that disc arthroplasty was going to decrease the rate that patients needed to go back to the OR for what we call adjacent segment disease, which means maybe a level below or above was going to go bad around that level that we operated on. But most of the literature kind of says the rate of adjacent segment disease or the rate of other segments wearing out is the same for disc arthroplasty versus fusion. But I do think there's some very specific patients that disc arthroplasty is useful for. So usually they're younger patients in their 20s or 30s. They're very isolated disease, both symptomatically and on their imaging. And so I think there is a role for it for sure. And I think that there's still development for disc arthroplasty, and there's still innovation for disc arthroplasty that's coming out. And in 5 years, we might be in a different spot. I mean, that's the exciting thing about spine. There is a lot of innovation. But that's the basics of disc arthroplasty.